you?
Good. How are you?
I'm doing all right. My name is Erica. I'm your nurse for today. The doctor ordered for me to check your vitals and also do a cardiac and respiratory assessment. Is that okay?
Yes.
Okay. Can you verify your name and date of birth for me?
My name is Tammy. My birthday is 4491.
Okay. Do you mind if I check your wristband, please?
Yes.
Okay. Everything look good. I'm gonna go ahead and wash my hands and provide you some privacy. I'm gonna start with your vitals. Do you have any allergies?
No.
No. Okay. I'm gonna start with your blood pressure. Okay.
Okay.
Do you know your baseline for your blood pressure?
No, I don't.
No. Do you prefer any arm?
No.
How does that feel? It feel okay?
Yes.
Squeeze your arm a little bit. Okay, BP is 138/92. All right, now I'm gonna check your pulse and your respirations, okay?
Okay.
Hold out this phone for me. your pulse is at a 18. I'm sorry, your respiration is at a 18. And your heart rate is at a 64. Okay, are you having any pain today?
Yes, I do.
Okay, what were you doing when this pain started? Like, were you reaching for something? Were you?
Oh,
Like,
I
what
was
were you
in my.
doing?
It first started when I was in my closet. I was reaching on the top shelf for
Okay.
something, and I
Okay.
had a pain like in my back.
More back. Okay. Okay. Can you describe that pain for me? Is it stabbing, throbbing? Is it a sharp pain?
It was like a sharp pain.
A sharp pain. Okay. And you said your lower back, right?
Yes.
Okay. From a scale to 0 to 10, how would you rate that pain? 0 being no pain at all, 10 being the worst pain of your life.
It was like an 8.5.
8.5. Okay. Okay. How long the pain last?
It lasted for at least like a minute or two.
Like a minute or two. Okay. Okay. What makes the pain worse?
I would say just if I'm reaching for something or if I'm bending over.
Bending down. Okay. 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 What makes the pain better? Like any medication?
Sometimes I'll take Advil or
Okay.
I'll put like a heating pad.
Okay, or a heating pad?
Yes.
Okay. Okay. Now I'll start with your respiratory assessment. Are you experiencing any shortness of breath?
No.
Okay, okay. Okay, respiratory is the same eupnea, normal, regular pattern, and no deep labor or shallow breathing. Have you been having a cough or sputum or mucus when you cough?
No.
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 Okay. Okay, so if you do start to experience a cough or sputum, which is mucus, the exercise I would like for you to do is if you're laying down, I want you to turn your head, cough, and then deep breathe. And do the same for the other side. I want you to turn your head, cough, and deep breathe. Okay, and I'm also show you how to use the incentive spirometer. So basically you would get this, you would breathe in, you will hold it for 2 to 3 seconds and do this 10 times every hour, okay? Can you show me what I just... Breathe in, hold it. Yep. And how many times do you need to do it?
Like 10.
10
times.
For every hour.
For every hour.
Yep.
Oh, okay.
Yep. And what that does is that clears the lung when you cough, and it helps with that you're breathing, okay? Okay, now I'm going to listen to your lungs, okay? So every time I place my stethoscope on you, I want you to do a deep breathe and then breathe out, okay? And normally this would be done directly to the skin, okay? You just pull your hair back. All right, I'm gonna start with the right upper lobe. Deep breath. Very good. Very good. You'll lift your breast for me. This is the lower left lobe. One more time. And this is the lower right lobe. Okay, and now I'm gonna have you to turn this way for me. Cross your arm this way, and I'm gonna check right here. Deep breath. Breathe out. Very good. Turn the other way. Same thing. And I'm gonna check right here. Deep breath. Breathe out. Very good. And I'm gonna move your head, stay that way for me, and I'm gonna check the back, okay? This is the upper left, upper right. Very good. lower right, okay, and lower left. Okay, very good. You can turn back forward for me. Okay, lung sounds are clear. Okay, now I'm gonna start with your cardiac assessment, okay? Are you having any chest pain?
No.
Okay, any shortness of breath?
No.
Okay. All right, so I'm gonna check for your JVD. I'm gonna put my client at a 30 to 45 degree angle. Ask you to turn that way for me. Okay, I'm gonna come to this side and turn that way for me. Okay, everything looks good. Okay. Now I'm going to listen to your heart signs, okay? Starting with the aortic valve in the second intercostal space. Okay, this is the aortic valve in the second intercostal space. I'm going to move over to the pulmonary valve in the second intercostal space. And then I'm going to move down to herbs in the third intercostal space. Moving down to the tricuspid in the fourth intercostal space. And then I'm going to go right under, that's it, in the fifth intercostal space where the apex is. And we listen to this for a whole minute. Okay, and then the only time we would turn our diaphragm on the bell side is when we want to listen for murmurs. Those are lower pitch sounds. Okay. Okay, so S1, S2 sounds are present at a regular rate. Now I would inspect and palpate your lower and upper extremities, okay, for edema. So hold out your arms for me. So we will start from the lower and work our way up. And we'll go all the way up. Okay, and we will do the same for the lower. Okay, and we will go all the way up. Okay, so skin color looks good. She's warm to the touch. Now I will check her capillary refill. Hold your fingers out for me. Okay, capillary refill, less than 3 seconds. Okay, now I'll palpate the pulses bilaterally. So I'm gonna start with the radial. Hold out both hands for me. So you do both, we'll do both sides. Okay, and then there's the radial and the tibial posterior, that is behind right here where that bone is, right there. Okay, good pulse there. And then the dorsalis pedis is right in the middle of the foot. Okay, and then of course you would do both sides. Okay, pulses are at 2 plus. And then I'm just locate the carotid pulses, which is in the neck right here, and then also on this side. Okay, the popliteal is right behind the knee right here. Okay, the brachial right here. Femoral will be right here in the crease right here. And then we also have the axillary, which is up under here. Okay. All right, that concludes my assessment. I'm gonna go ahead and wash my hands before leaving the room, and I'm going to put everything in for you, and your doctor should be with you shortly, okay?
Okay.
All right, thank you.
Thank you.